Now for next up, we're talking about a surgical procedure, okay, done in the urinary tract. And this is one is a Marshall-Marchetti. Okay, it's Marchetti. Okay, sorry, it's a C. I corrected it here, but I didn't correct it on the next one. So Marshall-Marchetti-Krantz procedure. Okay, so it's a procedure. It's a surgical procedure that they use to treat what stress urinary incontinence in women. So the aim is basically to restore normal bladder, neck, and urethral support by anchoring them to the retropubic periosteum. All right. So we describe it, right? So it will now prevent urine leakage during activities that increase intra-abdominal pressure. So such people, you should note that they are not having stress incontinence. It only comes in after they are stressed. Okay. They are not having urinary incontinence. Sorry, it comes in after they are stressed. Now, purpose of the Marshall-Marchetti-Krantz procedure is to correct the bladder neck from moving anyhow. So you want to elevate and stabilize the bladder neck and the proximal urethra. So it's often performed in women. So the women have like a general issue of pelvic floor, weakness, okay, especially after they underwent childbirth and all of that. Okay. So surgical technique overview is a suprapubic incision is made to access the retropubic space. That's like from the front. Okay. So the periurethral tissues near the bladder neck are identified. Sutures are placed in these tissues and anchored to the periosteum of the pubic symphysis. This will now create a firm support for the bladder neck. It will reduce the bladder neck moving too much. That's what we call the hypermobility of it. So risks and complication is urinary retention. So sometimes the bladder neck might be held in a position that is not allowing for urine to now be put out. Do you understand? Osteitis pubis, inflammation of the pubic bone, then voiding dysfunction. Or if such a person tries to have sex within that period, there's a whole lot of pain too.